So she's given a history about Nurse DiVas and Nurse Dawn Wellness Foundation. And a lot of times people hear the word DiVas, and it does sometimes have a negative stereotype behind it. But for this organization, DiVas stands for Developing Individual Victories Against Sickness, and that is what we stand for. We are a group of nurses, RNs and LPNs, who came together. We all felt that we were at a point in our career that we wanted to give back to the community. And so that's what separates us from a lot of the organizations, nonprofit organizations, is that all of us are either registered nurses or LPNs out in the community providing free workshops and seminars and health fairs. Okay? So today's topic is going to be on breast cancer awareness. Let me ask this question. How many have heard and agree with this statement? Knowledge is power.
Mm-hmm. Yes, absolutely.
Yep. Okay, I'm going to have to disagree. Okay? I believe that applied knowledge is power. Because sometimes we know better, but we still do not apply the knowledge that we know. And so the biggest fight against breast cancer is applying what you know. And so this presentation is not to scare anyone, but it's to share some facts so that you can apply the knowledge that you have learned today into your personal lives, into the lives of your loved ones, and combat this breast cancer fight. Okay? So what do we know about breast cancer? Anybody has had breast cancer or a loved one? I know the young lady who sung that beautiful song, she has a personal testimony. But anyone else? Yes. Breast cancer impacts over 240 new patients a year here alone in the United States. Approximately every 3 minutes, a woman is diagnosed with breast cancer. And approximately every 12 minutes, breast cancer claims another life. About 70% of breast cancer cases occur in women who have no identifiable risk factors. An estimated 40,600 deaths from breast cancer is expected next year. Breast cancer ranks second among cancer deaths in women. And breast cancer also strikes a small percentage of men. Okay? An estimated 192,200 new cases of breast cancer are expected to occur among women in the United States in this year alone. About 1,500 new cases of breast cancer are expected to be diagnosed in men next year. So, what do we know about the causes of breast cancer? To be honest, nobody really knows for certain what causes breast cancer. Why some women develop it, why some women don't. But what we do know, that you've done nothing wrong in your life to cause you to have breast cancer. You cannot catch breast cancer. It is not caused by stress or injury to your breast. And most women do not have any known risk factors or a history of the disease in their family. Getting older does, however, increase your risk of getting breast cancer, starting with the age of 40 and continuing into your 80s. So that window between your 40s and your 80s, that is that window that you are at an increased risk for developing breast cancer. Now, there are some risk factors associated with breast cancer. They include your family history, lifestyle, and personal history. So let's look at family history. If you have a mother, a sister, or a daughter who has developed breast cancer before menopause, you're 3 times likely to develop breast cancer yourself. If 2 or more close relatives, being your cousins, aunts, grandmothers, if they have or have had breast cancer, you are at an increased risk for breast cancer as well. Now, in recent studies, scientists have found that mutations in 2 genes, BRCA1 and BRCA2, will increase your susceptibility to develop breast cancer. However, there's a simple blood test that can be done to determine whether or not you have this condition. Your personal history. Like I said, if you've had breast cancer in the past, you have an increased risk of getting it again. Also, if you have had benign breast disease, such as fibrocystic breast disease, you are also at an increased risk. Now, some other risk factors put you at a greater risk of breast cancer, and that's if you started your menstrual cycle before the age of 12, if you are taking birth control pills, however, the evidence is not conclusive. Additional risk factors is if you've never had children, or if you have had children when you are 30 years of age or older. If you have had menopause at 55 and older, if you are taking hormone replacement therapy. And then there's also a strong link between your susceptibility to breast cancer if you have higher levels of estrogen in your body, okay? Lifestyle. Now, the good news is that several studies have found a lower incidence of breast cancer among women who exercise regularly. That's at least 3 times per week for at least 60 minutes per session. There is a higher proportion of breast cancer among obese women. There is an increased risk of breast cancer within increased alcohol use. 3 or more drinks per week. And that could be perhaps because alcohol increases your blood estrogen level. And as we learned in this previous slide, that there is a high, strong link between high estrogen levels in your blood and breast cancer. Here's a video on mammogram studies.
A mammogram is an X-ray of the breast. Mammograms can be used to diagnose bumps and lumps felt by the patient or the doctor. These kinds of mammograms are called diagnostic mammograms. Mammograms may also find tumors that are too small to feel. This kind of mammogram is called a screening mammogram. A mammogram may also find ductal carcinoma, abnormal cells in the lining of a breast duct, which may become invasive cancer in some women. To take X-ray images of the breasts, each one is separately pressed between 2 plates. Breast compression is necessary to hold the breast still and to take an image of all the breast tissue. The ability of a mammogram to find breast cancer depends on the size of the tumor, the density of the breast tissue, and the skill of the radiologist. An abnormal result does not always mean cancer has been found. Many types of cysts or unusual areas may appear on a mammogram. There are 2 other tests commonly used to screen for breast cancer. A clinical breast exam is an exam of the breast by a doctor or other health professional. The doctor will carefully feel the breasts and under the arms for lumps, or anything else that seems unusual. Breast self-exam is an exam to check your own breasts for lumps, or anything else that seems unusual. If a lump or other abnormality is found, an ultrasound or biopsy procedure may be used to learn more. There is strong evidence that mammography screening every 12 to 33 months can lower the risk of dying from breast cancer for women aged 50 to 69. If there is a strong family history of breast cancer, testing should be done at earlier ages and more often.
The recommended age to start your annual mammogram is at the age of 40 and every year after that. However, if you have a high risk for breast cancer, such as a family history, it is recommended to have it done earlier. Now, why do a breast self-exam? To be safe and to be sure. It's all about that applied knowledge. Breast self-examination is easy to do, and the more you do it, the better you get. Just like that old saying, practice makes perfect. When you get to know your breasts and how your breast normally feels, you will quickly be able to feel anything or any changes that you have not previously felt. And early detection is the key to a successful treatment. A breast self-exam could save your breast, but most importantly, save your life. Most breast lumps are found by women themselves, but in fact, most lumps in the breast are non-cancer. The best time to do a breast self-examination is right after your period, when your breasts are not tender or swollen. If you do not have regular periods, or you may sometimes skip a month, you can do it on the same day of every month. And I know that most of you are aware that Channel 19 has a breast self-examination initiative in which they remind and encourage women to do a self-breast examination every month on the 19th. So that could be your day as well. Remember, you are looking for changes, so you need to do a self-breast examination for at least 2 to 3 months initially, because this is the phase where you are getting to know your breast, getting to know what it looks like, what it feels like, and it's a baseline. So moving forward, you will be able to recognize the changes in your breast. You must also realize that 9 out of every 10 breast lumps found, thank heavens, is not cancerous. But it's better to be safe than sorry. Now, there are 2 basic steps to conducting a breast self-examination. First, you're going to look at your breasts, and then you're going to touch them. So the first step, the visual examination. You are looking for changes in each breast. So if your breasts have always been mushy, that's not a concern unless it is new. So you will want to stand in front of a mirror and look for the above changes in your breast. And you want to look from a frontal and a profile view, which is this one. This is your mirror, and this is a profile view. In 3 different positions. The first position is with your arms behind your head. You want to look frontal and profile. With your arms down at your side, frontal and profile, which is also a side view. And then also you want to bend forward, looking at your breast in a frontal view and a side view. The changes you are looking for would include the size, the shape, bumps or lumps. But note, normal lumpiness, like in the week before or during your menstrual cycle, will appear very small and separate lumps like the texture of an orange. You also want to look at the contour or the symmetry of your breasts and ask yourself these basic questions. Is there a difference in the level between the nipples? And do my breasts look symmetrical? You will want the answers to those two questions to be yes. Other changes to look for are sores or scaly skin, skin discoloration or dimpling in your breasts, and also a discharge from your nipple. The tactile examination, you will begin by looking for changes while standing up. Some women find this part of the self-breast examination easier done in the shower because of the soap or shower gel. It helps the ease of feeling your breast. For the breast self-examination, you will need to pick a pattern to feel your breast and surrounding areas, which include your breast itself, between the breast and underarm, under the arm itself, and the area above the breast up to your collarbone and your shoulder. So all this entire area is what's needing to be examined. It's important to check the surrounding areas because breast cancer may be found in the lymph node tissue around the breast and your underarm. You want to use the pads of your 3 middle fingers, is where your fingerprints are. These are your 3 middle fingers. You would want to take your right hand and press together flat to check your left breast, and the opposite for the right breast. It doesn't matter which breast you examine first. The key is that whichever hand that you use, you are using that hand to examine the opposite breast, okay? You should press on your breast with various degrees of pressure. The first pressure is a light pressure, which moves the skin without moving the tissue. The second level of pressure is a medium, which is midway into the tissue. And the last pressure is hard. You're going to press down into the ribs on the verge of pain. And this gives you the 3 levels of depths of your skin. Now there are 3 patterns that you can choose from when doing a breast self-examination. The first pattern is a spiral. You begin with a large circle around the perimeter of your breast and make smaller and smaller circles until you work towards your nipple. Another option is the pie-shaped wedges. You're going to pretend that your breasts are divided into sections like pieces of pie, and begin in the nipple area and fill your breast in a small circular motion within the pie-shaped section. Then you move to the next wedge, starting to the nipple area, and you will complete that cycle until the entire area is examined. And the last option is an up and down pattern. You pretend that your breast is divided in vertical stripes, and you begin on one side and fill your breast in a smaller motion, up and down, zigzag format. So when you're using any of the 3 patterns, you should always be using a circular rubbing motion, a dime-sized circle, without lifting your fingers from your skin. Once you perform the tactile examination while standing up, guess what? You have to do it while you're laying down. So you will go through the same process, but just in the lying down motion. You can put your left arm behind your head and use your right hand to examine your left breast. You can use a pillow or a towel to lift your shoulder to aid you in conducting the self-breast examination. Again, you want to use the 3 pads of your fingers and check your breast. And you also want to use the same pattern that you use standing up, either the spiral, the pie-shaped wedges, or the up and down. Be sure to always use the same pattern, because if there's any changes, you will better be able to identify those changes if you're using the same pattern of examination. Again, don't forget to feel your breast using the light, medium, and hard pressure points. And after you're finished you must repeat the procedure for the next breast. So once again, in my PowerPoint, it says the right breast, but it doesn't matter which breast you start off with. Now, what will you find possibly during a self-breast examination? You may find tender, lumpy breasts. This is usually part of a regular menstrual cycle due to the swelling and the water that we retain during that time. You may also find overall small lumps and a bumpy, grainy texture. If this texture is found on both breasts, in the area around your nipples, and the upper outer parts of your breast, you might have what's called a fibroid cystic breast, which is non-cancerous. You may also find single lumps that feels like an oval, and it is hard on the outside, but squishy on the inside. These are characteristics of a cyst. You can usually move a cyst under your skin, and they sometimes produce a dull pain. A cyst is a fluid-filled sac that can vary in size from a pea size to that of $50. Cysts appear most often in women between the ages of 35 to 50, and it increases as menopause approaches you. They too are benign, which is non-cancerous. You may also find a single solid lump that fills around like a small rubber ball and can be moved. It still can be moved. This may be a benign and painless tumor made up of connective tissues and other cells. This benign tumor may vary in size from a marble to a lemon. They are more commonly in women in their late teens and early 20s, or older women who are on hormone replacement therapy. Overall large lumps. These may just be exaggerated lumpiness in your breast called pseudo lumps. These may be caused by scar tissue, a clump of fat cells, or an abscess. And an abscess is a pus-filled sac. Sometimes nursing women will experience what's called mastitis. This happens when bacteria enters into the breast from dry, cracked skin. You may also find a single solid lump that cannot be moved. You want to look for hard, irregular borders to the lump. Also determine if the lump appears in only one breast and if it remains the same size during your menstrual cycle. Note that thickened or dimpling in your skin is a sign of a lump that cannot be moved. Other benign lumps that you may find in your body are movable because they are filled with fluid or lumps of fat. If all of the above occurs, These are symptoms of breast cancer. You need to get it checked out immediately. Sores or scaly skin. An open, itchy sore can just be a simple skin irritation, like from a new lace bra that may cut into your skin, or if you changed your laundry detergent. However, in a few women, this can also be a sign of Paget's disease, which is a rare form of breast cancer. So it's always good to get it checked out. You may also find discharge or dimpling of your nipple. You will have a persistent, clear or bloody discharge from one nipple. It may indicate cancer in your breast ducts. Also, an inverted nipple, which is a nipple that's pulled back into your breast. It may also be a symptom of breast cancer. If you find that you exhibit any characteristics or abnormalities or anything that concerns you during your self-breast examination, please do not procrastinate. Go see your physician immediately for a clinical breast examination and other tests to follow up. While some of the abnormalities mentioned usually are benign, there's nothing that's 100%. And it's a good thing to keep your doctor in the loop and to rule out breast cancer. Because as stated before, applied knowledge is power, and early detection yields early treatment, which yields a successful, more possibility to a successful outcome. Here are some resources to check out: Women's Information Network Against Breast Cancer, American Cancer Society Breast Cancer Resource Center, Breast Cancer Action, Celebrating Life Foundation, Department of Defense Breast Cancer Decision